It may not come as a surprise that the diabetes drug turned weight loss craze Ozempic is seeing a significant surge in sales, and it may be impacting the bottom line for some of the most recognized food and beverage companies. Our senior consumer investigative correspondent, Vicki Nguyen, has a closer look.
The diabetes drug Ozempic, often prescribed off-label for weight loss, is back in the headlines. This time for its skyrocketing sales. Its parent company, Danish pharmaceutical giant Novo Nordisk, reporting this week that sales of the drug are up 58% so far this year, raking in a reported $8.4 billion in revenue. The new class of drugs, known as GLP-1s, which includes Ozempic, Wegovy, and Mounjaro, work to suppress appetite, which means users reach for sugary and salty foods less often.
We have some patients who describe just a general decrease in that hunger. Some patients describe a complete absence of appetite.
But according to financial analysts, the soaring popularity of the drugs has some Wall Street investors betting against the future of snacks and beverages that have driven the obesity problem. The S&P Food and Beverage Index reporting a 12% drop over the past 3 months. Although it's hard to prove a direct correlation between the growing popularity of Ozempic and the recent stock falloff, the effects of the changing eating behaviors could go beyond the snack industry, too. One study done by the Jefferies Financial Group found that if the average airline passenger lost 10 pounds, it could dramatically impact how much fuel planes need to fly, equating to $80 million in savings in annual fuel costs per airline. And what about the potential effect on weight loss surgery? Johnson & Johnson CEO telling NBC News in a statement, "We are seeing some impact in our bariatric business in the short term as patients are reconsidering surgery," but adding that some bariatric surgeons believe going forward, the drugs and surgeries will be used together to help people lose unwanted weight. Jenny Zegler, the director of Mental Food and Drink, thinks concerns over the impact of the drug's popularity are inflated.
I'm not entirely sure that the food and beverage industry is going to be massively affected by this. Many companies have been on the path to creating healthier food and drink for quite a long time.
Adding that getting the drugs is still a challenge.
They're still very expensive. They are not as easily accessible. They're not covered by insurance.
For Melanie Manar, who says she's been on Ozempic for over 2 years, the drugs have been life-changing. But in the end, she says, they're not a miracle.
There's this big misconception that the medication does everything for you. Side effects wear off. Your hunger comes back. Your food choices become much more important.
So joining me now to talk about this is Dr. Sonal Harder with Dignity Health Medical Group. This is so wild to see the ripple effects that this drug has. And we talked about how expensive it is. How much is Ozempic?
Okay, so out of insurance, without insurance, it costs about $900, a little more, so $15,000 per year. Now with insurance, it's still expensive for most people. It's over a couple of hundreds of dollars, but there are ways to actually subsidize that price. There are some coupons that are given by pharmaceutical companies. There's patient assistance program. Shop in different pharmacies because different pharmacies have different rates. So those are some ways around it, but in general, they are not cheap.
So why is it not as easily accessible?
So I think it's a supply demand. Back in 2021, Wegovy, which is semaglutide, which is just like Ozempic, was approved for weight loss. And people saw weight loss on social media. We had about 300 million views on social media related to Ozempic or Ozempic-like medications.
Because they just wanted to see the before and after?
Correct, exactly, weight loss. And we also know that these medications truly are effective, not just for weight loss, but people who need it. It is actually helpful in losing weight, but diabetes control and overall reduction of inflammation in the body. So we know that for a proper patient, these medications are essential.
And we're talking drastic pounds. I mean, the kind of pounds that you would get through surgery, right?
Correct. These are medications that actually give us very good weight loss, almost equal to some of the surgeries we promote for weight loss. So they are effective, but caution here, they have to be used in patients who are medically approved for use.
Right, because the consequences, I mean, what are these side effects that people could be facing?
So the way these medications work, they slow down our digestion, but they also reduce our hunger signals in our brain. So most people experience some degree of nausea, constipation, bloating, abdominal discomfort. Sometimes it also causes some mood changes, but those are things that need to be monitored closely. Dehydration, muscle cramping is another form of side effects with these medications.
Wow. Okay. All right, Dr. Sonal Harder, thank you so much. I know you're going to stay with us
Yeah.
because later on we're going to be talking about dealing with stress.